Good day, everyone. So, once again, I'm going to present a new article, my third article under Module 7 Poverty, Hunger, Malnutrition, and Other Issues. The title of the article that I'm going to present is Poverty and COVID-19 in Africa and Latin America. So, this was written by Olivier Bargain and Olugbek Amij-Junov. So first part of the article is the abstract. So since March 2020, governments have recommended or enacted lockdown policies to curb the spread of COVID-19. Yet, poorer segments of the population cannot afford to stay at home and must continue to work. So in this paper, they will test whether work-related mobility is effectively influenced by the local intensity of poverty. And they found out that the drop in work-related mobility during the first lockdown period was indeed significantly lower in high-poverty regions compared to other regions. And they also illustrate how poverty has induced a faster spread of the virus. So the policy implication is that social protection measures in the form of food or cash transfers must be complementary to physical distancing measures. And this suggests that further research must evaluate how such transfers, when implemented, have attenuated the difference between poor and non-poor regions in terms of exposure to the virus. Second part of the article is the introduction. So with the global outbreak of the COVID-19 pandemic, governments announced shelter-in-place and physical distancing policies. In the absence of vaccine, such measures remain crucial to stop the spread of the virus. Yet, stringent containment policies may hurt poor regions of the world. Poor households have limited savings and food stocks, can rarely work remotely, and often rely on daily hands-on labor income. Thus, remaining stranded during lockdown periods put them at a high risk of extreme poverty. So that's the problem when the COVID-19 pandemic affect almost all the countries in the world, especially those people who are living in a low poverty line. They were the most affected sectors of the community compared to those people who are doing economically good in their lives. For the methodology, so this study mobilizes several types of data: the Google Mobility Index, the sub-national poverty rates, and statistics on daily cases of COVID-19. So these are the aspects where the authors got their information to come up with these articles: the use of Google Mobility Index, the sub-national poverty rates, and the statistics on daily cases of COVID-19. So for the Google Mobility Index, they use human mobility data from Google COVID-19 mobility reports, which aggregate anonymized data sets from users' mobile device location history. So these reports record percent changes in the number of visits or length of stay at various locations compared to a reference period of January 3 to February 6, 2020. So there are 6 location categories: retail and recreation, grocery and pharmacy, parks, transit stations, workplaces, and residential areas. That is for Google Mobility Index. For the subnational poverty rates information, they combined mobility data with poverty statistics at the level of subnational regions. Poverty is measured as headcount ratios, and for graphical analysis, they use discretized versions of regional headcount ratio, the binary and terciles. So a binary poverty measures takes the value 1 if the poverty headcount ratio is above the national average of regional poverty rates and 0 otherwise, while tercile measures are set of dummy variables defining levels of regional poverty as low as below 25th percentile of regional poverty rate within a country. So in estimations, they use both regional poverty rate directly as a continuous measure of poverty and its discretized versions. They also rely on official poverty statistics, and when missing, in their calculations using recent available household surveys. And for the statistics on daily cases of COVID-19, so to explore health externalities in the context of the COVID-19 pandemic, they assess how the effect of poverty on mobility reflects on the spread of the virus. They use the daily updates of the European Center for Disease Prevention and Control on the number of COVID-19 cases. So their estimations will also include robustness checks where they control for the one-day lagged number of cumulative COVID-19 cases. So in this article, the authors themselves are conducting some fieldwork and gathering relevant information. So the result of this article, while physical distancing helps to slow the spread of the COVID-19, it can carry a high cost of poor workers who have little savings and critically rely on the casual labor to cover basic needs for survival. As a result, the poor are more likely to show lower compliance with containment rules by continuing labor activities. Using daily mobility data for 9 African and Latin American countries, they consistently show that the decline in work-related mobility during lockdown is significantly smaller in subnational regions with higher poverty rates. They further characterize how the rate of virus diffusion increases with poverty through this channel. So those people uh, living in poverty lines, they are less compliant to health protocols provided by their government because they need to work to provide especially their uh, basic needs. Thus, lockdowns that are not accompanied by adequate social transfer programs are less likely to elicit broad compliance and can have serious consequences for vulnerable households. In poor countries, containment policies must be combined with consumption support. So this aid can take the form of transfers in cash if food markets are working or in kind benefits otherwise. So those to prevent those people from working outside, so the government needs to take action on providing them some aid, some consumption support to help them uh, overcome the difficulties brought by the pandemic. Many low-income countries are utilizing both existing new cash transfer schemes to reach the vulnerable groups during the pandemic. An obvious option is to scale up these schemes through temporary modifications such as removing work or school attendance requirements. So in Africa and Latin America, they use some cash transfer programs, cash subsidies to especially to those people or households struggling too much during the time of pandemic. In conclusion of this article, so they said that if no effective pre-existing system is in place, other strategies can be considered, such as geographical targeting based on poverty maps and epidemiological or containment maps. Several research paths are suggested. First, since current policy action is monitored in real time, future research could investigate whether social transfers such as those described above have promoted compliance with self-isolation requirements during the pandemic. Second, as a smartphone ownership and mobile internet usage are still relatively low in Latin America and Africa, corrections could be brought to our measures for imputation of daily mobility changes in nationally representative surveys. So, uh, in conclusion, the authors suggest for the governments and other sectors or organizations to explore other possibilities on how they could possibly help those um, households or people living in low economic situations to help them not to be uh, contracted with the COVID-19 virus. And that's all for this article. Thank you so much for your time in listening. Once again, I'm Ricky C. AROT, MAED student, major in social science. Thank you.